This uncertain school year is both different and at times difficult for both parents and students alike. Joining us now is Dr. Wendy Watson to give us some advice. Welcome, Wendy. Thank you so much for being here.
Thank you so much, Erica, for having me. I appreciate it.
First off, Doctor, what are the top issues that you're seeing with this unpredictable school environment right now?
There's so much uncertainty right now. Every school district seems to be doing things differently. Parents often don't know exactly what's happening until the very last moment. Maybe they just find out less than a week ahead of time that their school is going back. So parents have had to almost prepare for multiple different scenarios. And also kids have had to prepare for multiple different scenarios. And that is one of the most difficult things right now, is having so much that's just out of our control. And one of the things that I think as parents we need to do is really focus on what we can control.
Right. So Dr. Watson, speaking of uncertainty, what are some things that parents can do to help their children cope?
First and foremost, as you are on an airplane, make sure you put on, when they tell you to grab the oxygen first, then put it on your child. We have to do the same thing as parents right now. It's so important for us to be able to check in with ourselves first, see where we're at, do all that we can to really keep our mental health in check. Because our kids just, they're like little sponges. They absorb anything that we're around. They really, when they see mom or dad or grandma stressed out, they're going to feel stressed out too. They're going to know it. Probably the second thing would be is finding out as much as you can from the school about what's the school year going to look like. So if you can kind of go through and say, this is what your day is going to look like. If the kid's never been to the school before, drive by the school, prepare them. This is what your school's going to look like. And don't do this the first day. On the first day the school starts, you do this beforehand. Definitely some of the things that I've been working with parents in my clinic is get little kids used to masks. Again, you don't want to have them wear their mask the very first day of school for the first time ever. To feel like they have a little more control over what's going on.
So are there any signs that parents should be looking out for that may indicate that their child may need some help?
This is a wonderful question because, and it's one of the more difficult ones I feel like sometimes to answer during the pandemic, because there's certain key things that we look for in children. Changes in sleep. Are they sleeping way too much? Or they can't fall asleep because they're so worried. And changes in appetite. Things just like not being able to focus at all is really a big deal. Of course, any moods that, they're very upset or crying a lot. And these are things that I just want to point out for something in a pandemic many times are normal in a brief period. It's normal to cry when you miss your friends, especially, even as adults, it's normal to be upset. It's normal as a teenager when you're stuck with your family at home 24/7 for months at a time to want to be in your room talking with friends. You have to look at is it developmentally appropriate for kids? And also, is it short-term versus long-term? That's one of the biggest things. It's okay to be upset in the short term, but is this something that's lasting, weeks? That's when it's maybe time to go ahead and contact your pediatrician just to say, what are you seeing with kids right now? Is this normal? What should I do? And get some referrals from them if needed to just have them maybe talk to a counselor or therapist.
So, doctor, are there any last tips or advice you have for parents and kids to help keep them in the right frame of mind during all this?
The important thing is to be gentle on yourself, especially as a parent, and really having open communication with your kids right now so you know how they're feeling. Some kids won't be quite as open. You might have to share a little bit about how you're feeling so they can just see by example, oh, that's how we talk about emotions and feelings. So just trying to just prepare yourself for what you can do have some control over, and just trying to let go of what you really don't have any control over.
Dr. Watson, thank you so much for this great advice. We appreciate you.
Thank you so much, Erica, for having me. It's been a pleasure.
If you'd like more information, just go ahead and head over to the website.